So you just heard a personal take on depression, what it's like to go through it and live with it day to day. What about understanding the medical side of it? That's where we bring in psychologist Erik Fisher. He joins me now. Dr. Fisher, thanks for being here. This is so important to talk about. Robin Williams' death really brought this to light, but his representative said he was suffering from severe depression. But the critics out there immediately jumped on that and said, well, this act of suicide is so selfish. I first want to get your take on that, because I think that that automatically adds to the stigma of depression.
Well, I think just the phrase, until you've walked a mile in someone else's shoes. I work with a number of people who are depressed, who have had suicidal issues, and it's very challenging because for them, I see their bravery in living every day when they don't feel like there's anything to live for. It takes courage to live through that. It takes strength to live through that. And I don't think people see that. There is a neurophysiological reason behind depression, and we have to look at that. But also there are reactive reasons for depression. People who go through abuse, trauma, neglect, abandonment, their parenting issues. There's even temperament and how we're wired as an individual that as we come to this world that might make us more sensitive to emotion and how we react to emotion. So judging that from the outside, having not a true understanding, to me, it's a sign of ignorance and arrogance to me that I think we have to look at and get beyond to find the truth of what's going on.
Well, and the question is the medical side of depression. How do you know if you're just in a bad mood for a long time and you have a chemical imbalance and it is clinical depression? How can you tell between the two? Because as I discussed with Kat, it's difficult that you don't have an x-ray, a scan to say, here's my disease, as you would with cancer.
Right. Well, there are some techniques that they're looking at, they're exploring, looking at how brain mapping and things to see if they can show different areas of the brain that might be representative of depression. But the issue is, you know, usually prolonged times of sadness. For men, it might be that they just feel angry for a long time. Because we have to remember, men don't like to look weak. They want to look strong.
So their sadness may translate into anger.
Well, anger protects. Anger, rage, arrogance, flippancy, defiance, sarcasm, and hatred are the 7 protective emotions that I talk about. So sometimes when we have somebody who's flippant, who removes themselves from situations and pulls away, who always has a comeback or a joke or something like Robin Williams, his humor masked his depression. Sometimes people use that humor, which could be a sign that there's something deeper going on, hiding what they don't want to show. One thing that Robin Williams said is he talked about his addiction more than he talked about his depression, because it's almost more fashionable for a man to have an addiction because, hey, he can kind of laugh that off and it's part of drinking and this and that, which I think in our society we almost see as more acceptable, unfortunately, than we see depression, because we see depression as weakness, and it's just not the case.
And then let's talk about the suicide angle, because you had a picture that, if we have this picture, it was tweeted out, and it showed one of his famous characters, Genie in Aladdin, and he's being hugged by Aladdin, and it says, "Genie, you're free." It was seen by millions and millions of people via social media, and what's interesting to me, and I had this first reaction, this is quite the misconception, and I know psychologists have said this, of what suicide, what the answer is, and what happens after suicide. Why would you think this sends such a bad message?
Well, the idea that he's now released from his pain and he's in this wonderful place. And one thing about suicide is whenever I talk to people about their suicidality, I always say, all you want is the pain to stop. You don't want to end your life. Is that true? And they'll go, yeah. But it's getting that pain to stop. The core emotion to depression is hopelessness. The core emotion to anxiety is helplessness. He not only had depression, but his anxiety was chronically through the roof too. So combine those two together, and you have somebody who has a very, very difficult time, but sending the message that suicide releases you from something isn't the best message.
And Dr. Fisher, such important information for folks out there, and we also want to give people resources. I know our website has a lot of different things, suicide hotlines, and more information, so go to that HLNTV.com. Dr. Fisher, thanks for being with us.
Thank you.